I'm Dr. Sellinger, and I'm a dermatologist practicing general medical dermatology, cosmetic dermatology, and I'm also a dermatopathologist, which means I look at slides of biopsies underneath the microscope to help diagnose skin cancers and rashes for our patients. And what Botox and our other neurotoxins do is that it is a specific protein injected into muscles, essentially to prevent contraction of those muscles. Products we have commercially available today include Botox, Dysport, Xeomin, Jeuveau is the most recent one to come on the market. Lines on our face essentially all result just from our normal everyday facial expressions. Our wrinkles can either be static, meaning set in, and typically I see that in my older patients who've never been treated with their neurotoxin, just from time and making those facial expressions causing those lines to become set in. Our other type of wrinkle is a dynamic wrinkle, meaning we only see them when you're making certain expressions like frowning, raising your eyebrows, smiling. So those dynamic wrinkles come and go. Common areas to inject include the forehead, where you may get those horizontal lines set in, between the eyebrows where you can get those set in 11 type lines, or frown lines as we call them. We'll often do it around the eyes for our crow's feet. And there's other areas on the face as well, including above the lips sometimes, the neck even, where we will inject our neurotoxins to help relax and rejuvenate. A lot of patients get the concept of neurotoxins such as Botox confused with filler. With Botox, what we're really trying to do, as I said, is smooth out stubborn lines. With filler, what we're trying to do is replace volume. Long gone, I think, are the days of a complete, stone cold expression. And just by kind of carefully titrating our treatments, maybe using lower amounts of our toxins, diluting our toxins a little bit more, spreading out our injections through the treatment area, we can really kind of create a very natural look. In our office, you can always, rest assured that our product is diluted at a very consistent level. We have protocols in place exactly for how to reconstitute our products, or we never would inject a patient with expired product. Botox is not just for my female patients. Males are also great candidates for Botox too. Again, this is why it's important to see an experienced injector, someone who is very familiar with facial anatomy, so as not to overly feminize the features with muscle relaxation. But males can also see a lot of those same wonderful benefits of line smoothing, improved skin texture, as our female patients can with Botox injections. There is a recent study that shows that regular injection of neurotoxin can improve mood, and I have certainly experienced that myself, and my patients will tell me that as well. So aside from just purely a physical standpoint, I do think Botox has some other benefits. So a common question I get is, when should I start doing Botox or a similar neurotoxin? And it's individual from patient to patient. I treat patients in their 20s all the way up into the 80s. Patients will commonly kind of start with one area of injection, and then they may progress as time goes on to require toxin in additional places. Botox can be appropriate at any age, whether as a preventative tool or whether to smooth lines that are already set in. And your dermatologist or other medical professional can really evaluate your skin and discuss your concerns with you to determine where injection may be appropriate and helpful.